Dr. Zoe Martinez with Dunn Clinician is here with us to answer questions about ADHD. This person is asking, what is the earliest age for diagnosis?
So in general, someone who's not a child psychiatrist or a developmental pediatrician would never diagnose someone under the age of 4. There are occasional exceptions if there's a strong family history, but probably kindergarten age, so 5.
Okay, so we did have a question about a child who is 2 years old, maybe exhibiting signs, but that is not usually for the diagnosis.
That's under the age, so even a child and adolescent psychiatrist wouldn't diagnose someone at that age.
Okay, this person says that my child has ADHD but is doing well academically, and because of that, the school won't allow him to be on the IEP plan. What do you suggest?
So, so I would make sure that you write everything in writing, and sometimes parents think that they talk to a principal and that's enough, but it really isn't. Put everything in writing because that starts legal clocks. If you really can't find anyone, a lot of times there are parent groups in the area, or you can get support from another parent that might have gone through the same thing.
Okay. This person is asking, does getting medication for ADHD mean that you take it for life? And does it help kids who are having behavioral issues?
So being on medication for ADHD does not necessarily mean you have to take it for life. And yes, absolutely, those medications can help with behavioral issues. It depends on the behavior.
So can you kind of grow out of ADHD, or do you just learn how to manage it better?
So that I had mentioned that, I think, yes, you can outgrow, especially more of the hyperactivity, impulsivity symptoms. Those tend to go away. And also people learn to manage them better, which is also fine. None of those things require that you continue on medication. So if you're able to manage them in non-medication ways, that's great, but not everybody can.
I see. Okay. This person says, how do I start the conversation with doctors about having ADHD as a woman and needing a diagnosis? I'm being brushed off for other things.
So that's hard. I would say if you're seeing a non-mental health clinician, that can happen frequently. The first thing would be that I would like to talk to a mental health clinician. It doesn't necessarily have to be a psychiatrist. It could be a PMHNP, which are nurse practitioners that are especially trained in mental health care. Could even be a therapist, which could be an MFT or so. Like, I think the first thing would be to find a clinician that's willing to listen to you.
Okay, we have just over a minute. This person is asking, is Adderall addictive, and what happens if the dosage keeps increasing from 30 to 40 to 50 milligrams?
So yes, Adderall is potentially an addictive substance if not used appropriately. If any medicine's not working for you, you should probably talk to someone. It doesn't mean someone's an addict. It just might mean it's not the optimal medicine.
And this person says, if my child was tested in elementary for ADHD, did not have it, but continually struggled with testing, now in college, should he be retested if he struggles now with big exams and time management?
So yes, I would 100% agree. And I would say that even though there's a myth about that there's great testing for ADHD, it's mostly a clinical diagnosis. So that individual should probably see a mental health clinician.
Okay, great. Thank you so much for your time, your expertise. We appreciate all of that.